Hi, I'm Melissa Matta, Physical Therapist, and welcome to my YouTube channel. And this is my story. I have been a physical therapist for over 20 years. I got my undergraduate degree at UC Irvine and then went on to my master's in physical therapy at Western University of Health Sciences. Graduated in the year 2000. I always had a passion for outpatient rehabilitation, and so I worked in a number of clinics in Orange County, California, and quickly discovered that I really enjoyed working with my clients with shoulder dysfunction. And along my journey, I encountered a cluster of female patients who all had various shoulder dysfunction problems, aches and pains, but they all had something very similar in common, and that was their history of breast cancer. And it varied from lumpectomy to mastectomy to radiation to chemotherapy, the whole gamut. But what they all said to me was, well, I never had full range of motion and full function after my breast cancer treatments, and I just kind of thought, well, I beat cancer, I can just live with whatever limitation I have. And it really got me angry and frustrated and thinking, why is there such a gap with treatment and physical therapy after cancer rehabilitation in general, specifically breast cancer rehabilitation? So I kind of started doing some more research. I found some great continuing education courses and took those. That led me down a path, which then I got certified in lymphedema, and really started working with some of these amazing clients after breast cancer, and found that there was a big disparity. That I think the numbers they were saying was only 30% of patients got physical therapy after their treatments, when really 90 to 100% really needed it. So I continued to reach out to doctors and try to get more clients, and developed a comprehensive physical therapy program for breast cancer rehabilitation. Along the way, I found Pilates was a perfect fit for those clients. It was gentle. It addressed their lymphedema, it addressed their core strength, it addressed their range of motion, and it really was the perfect exercise program to implement for those clients. So I now have a full comprehensive breast cancer rehabilitation program that I start right after surgery and continue throughout their process, throughout their treatments, and even beyond. I have clients who now just see me for Pilates. They're 5-10 years out of their treatments, and we're just working on their continued strength, range of motion, function, and it's fun, and they feel empowered. I'm starting this channel because I want to provide more education and more empowerment to those women and men who are going through breast cancer rehabilitation. And I don't want this to be something that limits them for the rest of their life. These surgeries are intense, and there is some real big hurdles to overcome with scar tissue and shoulder range of motion and function, and stretching the tissue, stretching the skin. It's not easy, and so I hope that my little tidbits of information will help women find the treatments they need and get the help they need before it's too late, and to really have them be their own advocates for their health care. And really that's what we need in this time, in this world. So I hope that it provides that. I have a clinic in San Juan Capistrano, California. I work with another wonderful physical therapist who treats pelvic floor dysfunction. So together we treat the whole woman. I treat men too, but we have a special emphasis on women's health. I also work with patients of all of all ages and sexes, and I have a special love also for working with my geriatric clients, and Pilates is also the perfect program for them to continue with their function and the things that they want to lead a full life with. So I hope that my channel can provide some education and some empowerment, and I hope you enjoy. Thank you.